Okay, so today's topic is a very well-known and famous topic, and I'm sure everybody's ever heard of it. Obsessive compulsive disorder. What is obsessive compulsive disorder, or OCD? This is a personality disorder that is characterized by recurrent obsessions and compulsions that the individual themselves, they recognize as unreasonable. The individual knows that the obsessions and compulsions that they have are unreasonable. But there's two segments to this. There's obsessions and then there's compulsions. So what are they? Obsessions are anxiety-provoking and very intrusive thoughts. These usually or commonly are about contamination, viruses, sometimes doubt, guilt, sex, aggression. These are all things that can provoke anxiety and intrusive thoughts and become very obsessive about it. Now, what are compulsions? Compulsions are very peculiar behaviors that help reduce the anxiety that stems from the obsessions that the person suffers from. Hypothetically speaking, let's say you have a obsession with guilt. What is your compulsion going to be? Praying a lot, because if you're constantly obsessed about being guilty, you're going to constantly have a compulsion or a necessity to pray, right? If you have a security obsession where and self-doubt, you're going to constantly double check and triple check the locks at night. Or if you can't you'll unlock and lock the door 3 or 4 times at night just to make sure, because you have this particular obsession with doubt. Evidence suggests that obsessive compulsive disorder may be associated with serotonin metabolism, and as such, the pharmacotherapy that is used will possibly be some of the SSRIs, SSNRIs, as we'll discuss later. This presents in about 2% of the population, and the distribution is there's a 1-to-1 ratio. There's an equal distribution among men and women. Both of them get it at the same rate. There may be some genetics that are the genetic factors that are linked to this, especially if you have a first relative that suffers from OCD. The onset of this is during young age or early adulthood, and it's very insidious. It happens all of a sudden. The person starts discovering or having these type of compulsions and obsessions out of the blue. They just start to happen. They wax and wane. Sometimes they can be more, sometimes they can be less. So the symptoms are not always the exact same. There are certain other anxieties that are associated with this OCD, as well as substance abuse is very, very common among people that suffer from OCD. The treatment, well, there's behavioral therapy with relaxation techniques, guided imagery, exposure to whatever it is that's causing the obsession, and thought-stopping techniques that stops the anxiety developing from that particular obsession. If these don't work and their pharmacotherapy is necessary, we often, because it might be a serotonin metabolism issue, then we're going to give them SSRIs, tricyclic antidepressants or TCAs, and MAOIs, which are monoamine oxidase inhibitors. If you know anybody that suffers from OCD, or if you personally suffer from OCD, drop a comment. Let me know how it works for you. How do you get over these compulsions? How do you deal with them? How do you deal with the obsessions? What type of obsessions do you have? Is it unique to yourself, or do you see it in a family member? Please let me know in the comments. Don't forget to subscribe. Don't forget to like, share this with your family. And let me know what you think in the comments, and hopefully we'll see you in the next video.